Hey y'all, what's going on? It's your boy Mike. So, just leaving work, and something I wanted to talk about today was the importance of proper communication. There are so many people whose communication skills are lacking or don't understand that different people communicate differently. Some people are more visual, some people they learn by doing, some people learn by reading, some people just learn by teaching. There's no right or wrong way to communicate with people. The only wrong way to communicate with people, I'll actually preference this, the only wrong way of communicating with somebody is either not communicating or communicating in a way that they do not understand. For instance, it's like if you're wherever your country of origin is from. Again, I'm in America, so let's say if I'm in America, I'm going to Japan. I'm trying to communicate with somebody in Japan who doesn't understand English. And I'm getting mad at them. They're getting mad at me because we're trying to communicate, but nothing is getting across. And it's like, oh, why can't you just speak this? Why can't you just speak this? That's how communication breakdown happens. And unfortunately, you see it so often in the hospital that patients are getting information by providers and they're not communicating in a way that the patient can understand, or they're not breaking it down. They're not making it as simplistic as possible, because not everyone understands medical terminology. Not everyone knows what your blood pressure should be around. Not everyone knows the importance of maintaining sterile precautions. Not everyone knows why are we doing all these exercises before we have to get up. Why can't I just get up and move and do the thing? You said after my surgery I'm good to go, I can move around, but you're giving me all these precautions. You say I can't do this, I can't do this, I have to do this, I have to do this. Why am I doing that thing? I thought after the surgery I was perfectly fine. And that's where communication breakdown happens. That's where injuries can happen. That's where misunderstandings can happen, is by either lack of communication or lack of proper communication or lack of making sure that the patient understands. And oftentimes it's not the provider's fault. Oftentimes it is the patient's fault, because again, patients have to take responsibility for this also. Because oftentimes patients are like, yeah, I get it, where they don't really understand it. They just want to be respectful of the provider, or they're afraid of asking questions because they're afraid that the provider will get mad at them. And again, that's not the patient's fault. It's misunderstanding. It's not understanding that you have to be your own, be your own representative. You have to be your own support system. And if you do not understand something, you need to speak up. You need to speak up for yourself. And to say, hey, Mr. So-and-so, hey, Dr. So-and-so, hey, therapist so-and-so, hey, nurse so-and-so, respiratory therapist so-and-so, I don't understand what this means. Why am I doing this? I know that you said this, but I don't understand this part of it. One of the things that we'll always say is that you're gonna break your sternal precautions. What are sternal precautions? What does that mean? Where's my sternum? Why do I have to wait until this long for this? Because oftentimes people say, oh yeah, perfect example. After cabbage or a lot of chest surgeries, that they actually cut into the sternum. They actually open it up. Go inside, do what they have to do. Sew it up, glue it up. All that stuff. And you have a nice little pretty scar. A lot of people call it their zipper scar. It looks like a zipper. And a lot of times people will say, oh yeah, don't do these things till you break your sternal precautions. Why? What happens if I break my sternal precautions? Why are these so important? I understand that, I don't want to break my sternal precautions, but why? And then that's where I come in. I'm like, hey, do you know what you're supposed to do, what you're not supposed to do because of your sternal precautions? They'll say, oh yeah, I'm supposed to do this, this, and this, and this, and this. I'm like, do you know why? And they're like, no one ever told me. I'm like, okay, this is why. Because if you don't follow these rules, your sternum can actually shift out of place a little bit. Even though it is sewed together, it can shift just slightly. They can actually heal wrongly, which can cause a lot of problems, a lot of issues, can cause infections, things of that nature, which would not be fun. And that means the doctor actually have to go in, clean it out, and get you back and sew you back together pretty much. It'll take another 8 weeks for you to heal. Oh, no one's ever explained that to me. And that's where I come in. And granted, I will admit that the thing I love about being a therapist is that sometimes I get to spend a lot more time with the patients compared to the nurses or the doctors, because nurses are they're a godsend. It's like it's amazing what nurses can do, and their schedules are so busy that sometimes if they have a good day, then sometimes they can sit there and take the time to fully explain all the intricacies of why you do certain things, why you don't do certain things. Some days the nurses they get off 2 hours late. They don't get time for lunch. They are holding their bladders for 13 hours, 14 hours sometimes. I remember when I was a CNA, I had to do a double. I started work at 6:45. No, yeah, 6:45, and I didn't get to use the bathroom almost until I left. It was like 8 o'clock at night when I got to use the bathroom. It happens. So people are like, oh yeah, people hold back. It happens, and physicians are even busier. Like they have patients like all over the hospital. If they're a surgeon, they have to perform surgeries. They have to meet. They have to consult. Their schedules are so busy. Whereas with therapy, I like to integrate my education with my therapy session, because it's all connected. So while we're walking, I'm educating you, but I'm also, while we're walking, that's a fun thing about therapy, is that I get to multitask so often. I'm sitting there walking with the patient. I'm just like, oh yeah, no, do you know about this? I'm like, yeah, I know this, and this. But while they're talking to me, I'm listening to them, listening to what they're saying. I'm listening to how they're breathing. I'm listening to if they're conversating like this, or they're panting, if they're struggling. I'm looking into their eyes. I'm watching how they're walking. I'm seeing if they're stumbling over their words, or they're stumbling over their feet. So I get to integrate so much education with my overall therapy session. So everything's so integrated with therapy, which is why it's so cool, because I get to have that one-on-one time with the patient that a lot of other disciplines don't get. And like, granted, we do have productivity we have to meet. We do have a lot of patients we have to see. And sometimes I don't know which unit I'm going to be on. Sometimes I'm just in one building on 3 different floors, which is amazing, because sometimes it's like I'm on floor 6, 7, and 8. Okay, perfect. It's real easy. There are times I am on, the most units I've ever been on that I can remember was probably 6 or 7 different units. Granted, it was like 3 buildings, but I'm on these 3 floors, I'm on these 2 floors over here. In this building, I have these 2 patients. There are times I literally have 1 patient in like 3 different units. I was like, okay, I have 1 patient in 8, 1 patient in 7, 1 patient on 6. I have a patient over in 33, which is a different building. I have a patient in 99, which is a different building. I have a patient in 102, which is a different building. So sometimes I don't know where I'm going to be. So my schedule can get kind of busy too. However, I get the opportunity of educating a lot deeper than a lot of other disciplines, which is one of the amazing things about therapy, which is why I like therapy so much, because you have to really be a people person to be a therapist. Therapy is not for everybody. It's difficult. There are times where you're like, why am I doing this? There are times where you want the patient to heal more than they want to heal. There are times you see what the patient can do, but they're limiting themselves because of mental, emotion, whatever the case may be. They're limiting themselves, which is real. And again, don't get me wrong. Patients know they're going through a whole lot, but it's our jobs as therapists to educate them and tell them why it's so important to do these things. It's our job as a therapist. I like to tell my patients that one of the reasons why they send therapy in here so often is so we can get you back to feeling like yourself, because people in the hospital don't feel like themselves. They're trapped in this room sometimes all day. They can't move. They're in these weird hospital gowns with their butt showing. It's like you have people coming in constantly all hours of the day and the night. You have people checking your vital signs at 11 o'clock at night, passing meds at 3 o'clock in the morning. Sometimes you're getting a bath at 5 o'clock in the morning. Sometimes you're getting weighed at 4 o'clock in the morning. Sometimes you're literally trapped in your room. And forget about the ICU. That's a whole nother beast. There is such thing as ICU delirium, which they literally get confused, because some ICUs, they're legit just white. There's a lot of beeping, a lot of bells, a lot of whistles, a lot of wires, and it's just so much sensory overload that you will get delirious. You will get confused. And I like to say that they send therapy in here so you can say, hey, let's go for a walk. Let's get out in the hallway. Let's open your blinds so you can see outside. Let's put your clothes on. Let's brush your teeth. Let's wash your face. Because sometimes nursing doesn't have the time or the opportunity to help someone brush their teeth, to help someone wash their face, because they're passing meds and they have to go right to the next patient who may be sitting there coding, or who's just sitting there on a call bell for whatever reason. So sometimes nursing doesn't have the opportunity to help patients out. That's a cool thing about therapy, is like, we get to be that person to help someone feel like themselves again. It's like, oh, like, what's going on at home? Like, what are you struggling with at home that I can help you out with? Oh, I have stairs, but I have to sleep on the bottom floor because, I had this open heart surgery. I'll teach you how to go up and down stairs. Oh, I have a bath shower, and I can't step high, to get into there. I'll show you how to do that. Easy peasy, no sweat at all. So, therapy gets to be that person, kind of help the patient get to feel like themselves again, which is so cool. And again, while we're doing that, again, one thing I say is that the most important thing about therapy is communication. I tell patients all the time, if you're starting feeling dizzy, drowsy, sleepy, feeling weak, whatever's going on, you let me know. We can pull up a chair, we can take a standing rest break, we can call the nurse if we need to. If it's an emergency, we can do whatever we need to do. Our job is to get you safe and to get you functional and to get you feeling as close to yourself as possible with whatever limitations that you have. That's a part of the communication. So, I talk about that all the time. Like, you communicate with me, because I don't know what's going on with your body. No, outside. I can see what's going on outside, but you're the expert of your body. Like, I know the scientific stuff, but you've been living in your body, a long time. So if something feels off, let me know. When I'm checking vital signs, I'll say, hey, I look like, when we're checking oxygen, I'll say, I'm looking at 3 different things when I'm checking your oxygen. I'm looking at what you're looking like, I'm looking at the number, I'm looking at the wave pattern. If the wave pattern and the number are in a good range, but you look like you're struggling, something's off. If the number and you look good, but the wave pattern is off, something's off. So we have to look at all these different things to make sure that we're treating the patient the way they need to be treated. Because again, you can be presenting perfectly fine, but your oxygen is just like in the tank. You know what I mean? It's like, oh, you look perfectly fine. You're sitting here, laughing, kiki, ha ha, all this stuff. But I check your blood pressure is 86/40. You need to sit down. Like, we can't do that. We have to make sure that you are as safe as we possibly can be. We have to make sure that, we're getting you where you need to be as safe as we can. Our goal is safety first, and then comfort. I want to get you home, but I want to make sure that when you get home, you can get home and you ain't got to come back 2 seconds later, because we see that happen all the time. Like, someone comes in and it's like, yeah, we go home, and it's like, you're reading the chart and it's like, yeah, patient was discharged, came back the next day for this, and this. It's like, come on now. So we have to keep patients as safe as we possibly can be. And again, that's where the communication comes in. One of the examples I actually gave today is I was talking about dizziness, and I was talking to a patient because they were saying, hey, I need to sit down. I'm like, okay, cool, let's go ahead and sit down. And I was asking them a series of questions. I was like, how does your heart feel? Does your heart feel like it's racing? No. Okay, how is your breathing? Does your breathing feel fine? My breathing feels fine. Are you dizzy? No. Okay, are your knees hurting? Yes. Okay, perfect. Because depending on what is the reason that you need to sit down determines how we need to treat. If you need to sit down because your heart rate is pumping, okay, we gotta sit down. It's nothing issue. It's not a big thing. But if you just had open heart surgery, or if you had a pacemaker put in and your heart's going, we got an issue. If you're admitted for a cardiac issue, but you say you need to sit down, it's like, okay, what's going on? But your knee's bothering you. It's like, okay, how's your heart feeling? Your heart feels fine? Okay, good. We're good with that. We can keep moving. We just need to take a rest break to let your knees rest. But as long as your heart is doing good, the main issue why you came in is not the issue. So we're good on that. Perfect. Let's keep going, but we rest while we need to. So good job. And I was also explaining to the same patient, I was talking about the reason why we need to pay attention to what's going on, the causes of dizziness, particularly with the heart. And the way I like to describe it is, I'm trying not to spill, but I got a water bottle. I'm like, okay, this is representative of your body. The water is your blood. If you're laying down, it doesn't take a whole lot for your blood to get from your feet to your head. It doesn't take a whole lot. But as you change position, your heart has to work a lot harder to get the blood from your feet to your head. So as you change positions, if your heart is not strong enough, you can get dizzy. Again, it's one thing to go from here to here, but as you go from here to standing, if your heart is not working strong enough, then you can get dizzy, you can fall. So it's so important that you communicate with me, that I know what is the cause of your dizziness. Because if your heart is having an issue, it's not pumping properly, then we got an issue. And that's also a reason why it's so important to warm up before you start working out and after you're done working out, particularly with therapy with heart patients, because the way I like to describe it, again, I'm full of analogies and things like that. It helps make sense, because again, not everyone speaks medical terminology, but people know what it's like to warm up a shower. People know what it's like to turn your car on. People can see the water in the bottle. And what I like to describe, doing your warm exercises for therapy is I say, hey, let's say if you're in a state where it gets cold. Again, Florida, it gets cold, on occasion, but not like it does up north, not like it does like New York or anything like that. But let's say you're in a state where it gets cold and you have to drive somewhere. Are you gonna put the key in the ignition, just hit the gas and just go? No, you gotta warm it up so your engine can actually warm up properly, and then you can go. That's why we warm up when we do our therapy exercises, particularly with cardiovascular patients, because your heart has an issue going on. Your heart is confused. It doesn't know what's going on, particularly after surgery. It's like, what the heck is going on? I'm not sure what's going on. So when you do these therapy exercises, like you move your ankles, like do some kicks, you're kind of like warming up your heart to say, hey, it's time to do a little something. It's time to do some work. And it's like, okay. So once you start doing your work, your heart knows, okay, I need to pump a little bit harder so my blood can get where it needs to go. It can go from my feet to my head to my hands, all the extremities where it needs to go, so we're good to go. Okay, cool. So again, car analogy, you warmed up the car, now it's time to go, you're going. Now let's say you're driving and you hear a sound in your engine. It's like, oh, I need to work on my engine. You're not gonna just pull your car over to the side, pop the hood and start working on your engine. No, it's not gonna go good for you. But you let your car cool down so you can work on your engine. Same thing with the body. When you're working, you want your heart rate to go up so your blood can get to where it needs to be. So it can get from your feet to your head, all these different places. We expect it to go up a little bit compared to if you're just laying down, sitting down. When you're active, we expect your blood pressure, your heart rate, all that stuff to go up. However, whenever we're sitting down, we don't want it to stay up. We want it to cool down. So whenever you're done with your walk, we want to do some cool down exercises to tell your heart, hey, we exercise hard. Now it's time to relax. It's time to calm down a little bit. Because again, let's say if your heart rate goes up to like 120 when you're walking, just for numbers' sake, that's a pretty fast pace, But it's understandable, that your heart rate is going to go up. But if you're just sitting down, your heart rate's, that's an issue. Particularly after surgery, that's an issue. So it's like, now we gotta figure out what's going on with this. And that's where the communication comes in, because patients are like, why do I need to do this? Why do I need to do that? My doctor just says I need to do this. And a lot of people don't ask why. Because again, some people are afraid to ask the doctor why. It's like, no, the doctor knows all. We don't question the doctor. But you need to question the doctor. You need a question to make sure that you're safe and to make sure you're understanding why you're doing certain things. Because if you don't understand why you're doing certain things, a lot of people are like, oh, I don't care, I can do this whatever. An example, whenever I used to work in orthopedics, is that we tell the patient, it's like, okay, like whenever you're, if you had a hip surgery and knee surgery, go up with the strong leg, down with the not so strong leg. And we'll tell them, okay, this is why, because you need your support to kind of push up, you need your support to carry you down. It's like, oh, I can do it with my weak leg. It's like, okay, go ahead and do it with your weak leg. It's not an issue. You can do it with your weak leg. However, it's going to be harder. And why make life harder on you? Why not do the things that are going to make life a little bit easier for you? So there's certain things that's like, okay, you can do this. It's just going to be a little bit harder, a little bit easier. That's where education comes in. Or if you do this, you're going to crack your chest open. And we got to go back in, clean it up, and sew you back in, and then you can be in. Then you have to have the precautions for longer. So those things you don't mess with. That's where the education comes in. That's where the communication comes in. And that's why I say Communication is one of the most important things and one of the most important aspects of therapy. Yes, we need to know how you move, but we can't progress you if we're not communicating. We don't know how to treat you if we're not communicating. We don't know how to address the issue or what the issue is if we're not communicating properly. And again, that's why I like therapy so much, because I get that opportunity to educate, to teach people about the whys behind the questions, the whys behind the rules. It's like, why do I do this? Oh, I can teach you why. I can show you why. I can show you this. I can show you this analogy. I can tell you this, show you videos, all the fun stuff. That's what we do with therapy. That's one of the educational pieces of therapy, which is why it's so cool. Now, again, that's one of the perks of therapy in the hospital. Different therapy places. There are pros and cons. Sometimes you get to educate a little bit differently at different facilities, but again, that's why I like acute care therapy so much, because we get to do that education, we get to do that communication aspect that not a lot of other disciplines can do, because we have, again, depending on the facility, depending on how you treat and how you coach, you have that freedom to educate patients the way that people don't get to educate them. And you'll be surprised how many times in a day, not just like once or twice a week, in a day, patients like, I've never heard that. Thank you for explaining this to me, or that makes so much sense. Thank you for making it make sense for me. Because one of the things that I was learning in one of my education classes is that I think it's the vast majority of reading material, like education material, needs to be at like a 5th grade level. However, when you have people who are so educated, sometimes we forget that everyone doesn't have the same education or same background that we do. For instance, doctors, they have so much education, the time, the commitment they spend in school, the wisdom that the vast majority of these doctors have. It's insane. And some people are so smart that they can't turn down the intelligence to communicate to the average Joe. The average Joe doesn't know what a myocardial infarction is. The average Joe doesn't know what orthopedic hypotension is. The average Joe doesn't know what leukocytopenia is, or anything like that, or a thrombolytic, or MI, or these people don't know what these things are. So you have to be able to explain it to people so they can understand. It's like, oh, this is why we don't do these things. People, there's so many things that we say that we forget that we have to translate it. And that's where things, sometimes we have to translate it twice. Sometimes if there's a patient that they don't speak English, you have to translate. We have what we call a Stratus, which is a translation device that we have, translators that we can contact and everything. And sometimes you have to translate it to the translator so the translator can translate it to the patient. So I have to translate myocardial infarction to the translator so the translator can talk to the patient. So oh, okay, this is why I don't do this thing. So we have to translate translations so many times. But again, that's where the communication comes in. That's why it's so important to communicate with patients and to make sure they're understanding what you're saying. Because so many things get so lost. Some people are so confused. Some people are scared. Because a lot of medical terminology, a lot of medical language is frightening if you don't understand what it is. Oh, I had this going on, this going on, this going on. Oh my gosh, I can't do anything. It's no, you can do a lot. You can do a lot. You have a pacemaker. Yeah, it's fine. We can teach you how to get out of bed. Yeah, you had a 5-way blockage, and then they had to do a coronary artery bypass graft. Yeah, we had heart surgery. Doesn't mean you're an invalid. There's a lot of things we can do. Just because you had a surgery doesn't mean you can't do anything. And a lot of people are afraid in the hospital. A lot of people don't get that translation. So that's why you have to communicate. That's why you have to translate to patients so they can feel seen, heard, and so they can get back to their everyday lives. Because that's one of the most important things. That's why we do healthcare, is to get people to feel like themselves again. Because who wants to be trapped and locked up and can't do the things that you want to do? It's imagine being in your 20s, you're at the height of your life, you're doing this, you're doing that, you're moving, you're doing all these different things by yourself. Then you come to the hospital and you have a Foley catheter. So you got something that's in your bladder to help you pee. And you can't get out of the bed because they have a bed alarm. And you got people feeding you this food that you don't like. And you can't sleep because there are people coming in your room at 5 o'clock in the morning. It's horrible. The hospital it's an intense place. And it's scary whenever you don't know what's going on. But when someone can educate you and translate, it takes some of that fear away. So that's why it's so important to communicate. Now, particularly in a hospital. Now I can talk about, the importance of communication, in the gym, in school and things like that. I may make some videos about that. But this is, particularly about healthcare, about hospital life, why it's so important to communicate. But yeah, just want to sit here, chop it up with y'all for a little bit. I'm gonna go home, get these people flakes off of me, and chill for the night. So, all right, catch y'all later. Deuces.